Dementia Researcher with a blog and a rating.
As we venture out into 2024, it's only natural to want to look back at 2023 and consider what went well, what didn't go so well, and areas we can look to improve on in 2024. It's common to do this kind of reflective summary around our own personal lives at this time of year. That's the whole rationale behind New Year's resolutions. It's that opportunity to change your personal perspective and try and make positive change. But why stop at self-reflection? Why not take the opportunity to look back on 2023 and ask, what else did we learn? One thing's for sure, 2023 felt like a landmark year for dementia research. Now in October 2022, I wrote a blog where I said that it felt like we were about to enter into a really exciting time for the field. I expected to see breakthroughs finally start to happen, and I was hopeful we would start seeing dementia make the headlines for all the right reasons. Looking back, that certainly seems to have happened. We got our fair share of the less uplifting headlines too, with news outlets reporting predictions of increased rates of dementia in the coming decades, public figures opening up about a diagnosis. But what felt like it was different was the fact that we saw those stories followed by reports of clinical successes. The general public saw headlines of immune therapy drug Lecanemab gaining FDA approval for use in early Alzheimer's disease. We heard figures like 27% improvement in memory loss and a 56% reduction in loss of quality of life. After decades of attrition with what many perceived to be little progress, this was big news, and it got people talking. I looked through my messages on WhatsApp, and for the last year I could see many instances of dementia making the news, and someone then asking me about it. Lecanemab was big news, but we also saw Eli Lilly on the news reporting very positive results with their drug, Degenerative, and a further trial with a new drug concluding early this year. For years, dementia has been viewed as a silent evil that ticks away in the elderly unchecked and free to wreak as much havoc as seem fit. It becomes very difficult to retain public interest and understanding about a disease it feels like nothing can be done about. Cancer sits well in the public domain, not just because of the severity of the disease. We also have treatments and can empower patients with the belief that we can help them. In 2023, it finally started to feel like we could be heading towards a reality where we can do the same with dementia research. It wasn't just news coverage as well. That has a knock-on effect in all avenues of the media. We saw more social media posts, more online articles targeted at dispelling myths, reducing the stigma and trying to create a more empathetic understanding of the disease. AR UK published their latest report on public attitudes towards dementia. And on the first glance it looked similar to the 2021 report, with little difference in the proportion of people who are aware that dementia is not a normal part of ageing. However, the prevalence of good news stories and media focus on promoting a better understanding has shifted a critical aspect of public understanding in a positive direction. The report showed that more people are aware that you can influence your risk of developing dementia. More people would want to know about their risk. More people would take a test, would get involved in medical research, and the public appear to be increasingly aware that current clinical options fall short and we need preventative measures. And that last part is arguably the most critical. A big difference between dementia and cancer lies in the prognosis at the point of diagnosis. When a cancer is diagnosed, there's often treatment options for the patient. When a patient is diagnosed with dementia, however, the point of effective therapy is often gone, although we're slowly improving this and creating therapies that can help at the point of diagnosis. This is why I think it's so promising to see increasing numbers in the general public showing an awareness that preventative strategies are critical. People saying they will take a test shows they know the understanding of your own personal risk as early as possible is important. Pair that with an increased public knowledge about what we can do to try and reduce our risk, and we're building a population armed with knowledge of what dementia is, what we can do to help patients, what they can do to help patients, and how they can reduce their own risk of developing dementia. Public understanding is critical, and it does nothing but benefit our efforts to fight dementia. I firmly believe that 2023 was a landmark year for dementia research, and improvements in public understanding went hand in hand with that. A convergence of breaking new therapies, increased media coverage, and heightened public awareness made 2023 a transformative moment in the journey towards more successful and compassionate dementia care. I think that's something worth raising a glass to in the new year. Onwards and upwards.
Thank you for listening. Join the Dementia Research bloggers and share your own views.